I think the most impactful one, Nodify case that I've had is one that I presented at Chest a few years back. And this was kind of one of those when we just had we'd been surveying a small ground glass nodule for years, smoker, emphysematous COPD, pretty advanced. So we elected for surveillance on that patient. This test became available, so I said, I know we've been following this ground glass nodule for 3-4 years. Let's put this in because there's some solid component. Is that solid component related to the emphysema? Is it something else? We've kind of noticed that in the last couple years. It's not necessarily growing, but it's big enough to qualify us for this test. And so we went ahead and sent the test, and her CDT came back positive, and her risk went from 30 to like 78 or something like that. And so in retrospect, we would have continued to follow that patient because although there had been, and I say 4 or 5 years, I mean, really she had CAT scans going back a decade. So over this time frame, yes, there'd been a solid component that had developed but not expanded, right? So high risk, you're super worried. It's sitting next to a bleb. This is not going to be an easy biopsy anyways. Long and the short, I think we would have continued to survey this patient over time. With those results, we decided to go ahead for biopsy, and she came back as adeno in situ, and she was not a candidate for surgery, unfortunately, but she went for radiation, and I still see her in clinic every day, and she's doing great. So I think that is a really good example of how you can utilize this test and change what you would have otherwise done.
My most impactful Nodify case. I had a patient with bad COPD, kind of a frail elderly woman who really didn't want to have much done. She was really worried about getting a biopsy. She was really worried about anesthesia. People had told her that if she went on a breathing machine, she would never come off. So she was really worried, but she was also worried that she had cancer. The particular nodule was also in a very difficult spot. I was concerned that the risk of complications for biopsy were going to be high. And I really was not eager to put her under anesthesia to do a complicated, prolonged procedure, especially if there was a reasonable chance that this wasn't cancer. We sent the Nodify, and the results came back likely benign. And so I was able to share that information with her and discuss it with her and discuss how I felt pretty comfortable just following this and doing a follow-up CAT scan in 6 months rather than going ahead with a biopsy right away. And she was very happy with that. And it's now 2 years later, and the nodule never changed. And, so I'm pretty happy with that decision.